This picture is mouth trauma that came in to a traumatic injury to his mouth. The patient was about 25 years of age, and as you can see, pretty blunt force, object that hit here. And so there was a lot of bone recontouring. We did bone grafting procedure that day and placed, multiple sutures into the area. The picture here that you see 2 weeks post-op, using the rinse and the debriding gel that was in the pen for the take-home use. This patient used it very religiously. He had a lot of trauma to that jawbone, and I think, from what he reported to me, his pain wasn't as bad as what he thought it was. We used a class 2 narcotic and we used ibuprofen, but he reported back 2 weeks later that he hadn't needed very many of those at all. I think only one of the class 2s, and just stayed on some ibuprofen for 3 or 4 days post-op. And he could just tell he actually carried the rinse with him everywhere he went, because he just felt very soothed as he was, walking around doing whatever he had to do during the daytime. He just felt like he almost kind of got, hooked on that, because it just felt so good to his gums and made him feel a whole lot better.